a woman. Help me believe what I could be and all that I am. Show me the stairway I have to climb. Lord, for my sake, teach me to take.
Dearly beloved, I bring you greetings from the Insight Studios, and you are watching the Virtuous Woman's program. You know, this is a program that is all about women, it's all about the feminine side. Yeah, and I am your host, Susie Osikeni Georges. Right after birth, finally, when you meet your prince or princess, it is automatically assumed that you'll be happy to meet him or her. But this is not always so. The arrival of a baby brings lots of changes to the family and to the mother herself. This time after birth is termed postpartum. And in this period of time, a lot goes on in the life of this woman. She might be struggling with breastfeeding. She might be struggling with anxiety of not being able to take care of her newborn baby. For some, it becomes pain. It becomes a disorder. And so, we want to talk about postpartum depression. It is one thing that most women don't talk about because of fear of stigma. And also being judged, especially by their own fellow women. Some will say, but it is a disorder that is not coming from the woman, but it is just the way she is feeling or thinking. And so we want to talk about postpartum depression. If you are watching us, and you have had those odd experiences after birth, please, in the comment section, you can share with us. Let me also take this opportunity to let you know, if you are willing to share this story with somebody to help and encourage somebody, you can just contact me. The pregnancy diary has gone far to bless lots of people. The comments and the recommendations are overwhelming. I've had lots of calls from big men and women recommending us of the job we are doing, especially our guests who freely come out to share their experience just to encourage somebody, to get somebody to be informed of what is ahead of her. And so, if you are a woman out there, you are a mother out there, and you are willing, yes, willingness is the first key. You are willing to share with us your pregnancy journey, you can also contact me so that all together we can affect positively the lives of other women. Today, as I said, we want to talk about postpartum depression. And to help me do this is, as I always call her, a vibrant young lady. She is a mother. She is a nurse by profession. And if you always hear of glorious worship, she is that vibrant woman behind it. She is no other person than our own lady, Mrs. Judith Equia Asante. Lady Judith, you are very much welcome to the Virtuous Woman's program.
Thank you so much, Lady Susie. I'm honored.
How are you doing?
I'm fine, thank you. Hope you as well.
Yeah, we are all doing very, very well. We are always happy, and it is always a privilege that when we come to you and we invite you to the Virtuous Woman's program, you come really freely to come and share with us your knowledge about what we need to know or to be aware of. And so, we are talking about postpartum depression. Lady Judith, can you tell us what it means, postpartum depression, and how common it is in women, or how common it is with mothers or newborn moms?
All right. Thank you so much for this opportunity. So, postpartum depression is, I will just break down the word. Postpartum means the period after you've given birth. That is called postpartum. Or in some other countries, they say postnatal. So, after you've given birth, that is the postpartum. Then depression is one type of mood disorder. I would say one type because we have various mood disorders that affect the mental health. And this can affect, this postpartum depression can affect you shortly before you give birth or after you've given birth. So this is what I say, this is the definition. And let's say between 50 to 80% of women go through this type of disorder. Later on, I will explain which type, because we have the baby blues, which is the first days into the 2 weeks or 3 weeks after you've given birth. And then if these symptoms are not normalized, then you go into depression. So this is what I'm saying.
Okay, so it is a disorder that normally happens right after birth, and it is also called the PPD. So when you hear postpartum depression, that is the PPD. Now we know what it is and how common it can be among women. So for me to know whether I am going through this disorder, what are the signs and the symptoms that will be showing for me to know or identify, either in me or somebody, that this is a postpartum depression disorder?
Thank you once again. So, as I said, once you give birth, it's a bit normal for you to be a bit anxious because you have a new baby, you have a new human being you are taking care of. So you might be a bit worried about the future. You don't know if you'll be a good mom. You don't know if what you are doing is even the right thing. So those feelings are normal. So the baby blues, as I said, they come within the first few days up to 14 days, or let's say 3 weeks, where you are a bit worried about everything. You might feel a bit sad. You are a bit anxious. You are uncertain of the future. You are worried. You don't know if I'm being a good mother, or you are a bit fearful sometimes. You are very sensitive. Any little thing, you come into yourself because you don't know if everything you're doing is right. Or you may feel very tired because, of course, when baby comes, the first days, or let's say for a couple of months, you are not sleeping the way you used to, because we know babies, they tend to wake up during the night, so you don't have enough rest. So all these things, you can even have some mood swings at times. So all these things are normal. So this can be baby blues, all right? But then when we talk about depression, the symptoms are a bit more problematic. So you used to be a cheerful person, always bubbly, but then at some point you want to isolate yourself, or you withdraw yourself from people. The things you like to do, you don't do them anymore. You can't sleep, you can't eat, you are always crying, and you have mixed emotions with your baby. You don't even have a chemistry. You don't feel anything for the baby. Your temper is really high. You are very emotional. Some things, or let's say some words these mothers will be like, I don't think the baby likes me. I'm not a good mother. I've lost myself. I've lost my life. I'll never be normal again. I don't understand what's happening to me. So these are the signs of baby blues or PPD, postpartum depression.
Wow. So, if we see, talking about all these signs, is there a cause or what are the risk factors that may result in a PPD or postpartum depression?
Thank you so much. So, I would say there may be some issues that will predispose you to have depression, or you have some risk factors that will give you the high probability for you to have depression. But that doesn't mean that if you have these issues in your life, that doesn't mean that when you give birth, you will surely have postpartum depression. So let's say risk factors can be social or can be physical, let's say. So social risk factors, I believe the number one social risk factor is financial issues. So you don't have enough funds to cater for you and your child, or you and your new family. Or maybe you have relationship strains with your partner or with family members. Or maybe you are a teen mom, you are a single mom, you had an unplanned pregnancy. So all these things make you feel like you think too much. So these can be some of the risk factors, like socially, as I said. Or maybe you have lack of support. You don't have enough people around you to help you. And for the physical ones, we can say the number one for us women is the body changes. So you can't accept your body image. Like, as an example, maybe you go through C-section and the scar that you see, and like you don't feel yourself anymore. So body changes is the number one factor or risk factor about physical factors. And then maybe during the pregnancy, you had a difficult pregnancy. So complications, or maybe even during labor, or even during your birth. So you had a birth trauma because what you thought will happen didn't happen. So everything just came like that. And maybe you already have a history of being anxious, a history of having other mental issues such as anxiety, bipolar, or other types. And another factor can be infertility. So you struggled a lot before becoming pregnant, and the process was quite difficult. And now that you have the baby, you are so overwhelmed that you don't know how to control yourself. So let's say these can be the risk factors.
Okay, the risk factors. For us not to get to a point where we are depressed after birth, what can we do to prevent that from happening? And then the people around us, we have our family members, for example, our partners, our sisters, our in-laws around us. What can they also do to help us so that we can prevent being depressed after birth, which is the postpartum depression?
Yes. Thank you so much. So this disorder can be prevented. It can be prevented based on the people you have around you and you yourself, if you have knowledge about these signs, and so you can tackle them easily when they come. So the first, let's say, prevention, I would say, for us as a married woman, I would say it's our partners or our husbands. So the partner or your husband should know you, should know their woman, should know their wives. They know when something is wrong, they know when something is not wrong. So if you know your wife very well and she's going through something, and you see that her behaviors are changing, I believe the partner should be the number one people to recognize this. So it's very important for our husbands, one, to know your wife, of course, so communication. Unfortunately, in our African community or in our African marriages, there is not a lot of communication between the man and the woman. It's like we just have to make babies, and maybe sometimes the only conversation you have with your spouses when they want to have intercourse with you. And I think, but thanks to God, in let's say our generation, our husbands, they are more enlightened about this. So the communication aspect and the relationship between them is better. And I would say it's also best for them to have knowledge about this. So once your wife gets pregnant, it's not about, okay, I'm just waiting for the baby to come. You have to get wisdom, read books, find research what can happen during a pregnancy, what can happen. And so be expectant. I'm not saying you should expect this to happen, but what I say, if you have knowledge, you know that something is wrong somewhere. And then when our husbands ask questions, we, the women, we have to be honest and open up. Sometimes we don't want to open up because we don't want them to know that something like that is happening. And as soon as maybe you share a strange behavior, or maybe you talk about something, you are afraid they are going to say you are mad, because some people don't have knowledge, they don't know, like having depression is not being mad, okay? But then if you say something that is not really normal, then you say, okay, you are mad. So the woman will try to hold it for herself, she'll just keep it for herself. So even as we women, please, you don't have to blame yourself. You just have to be open. If someone is coming to you to give you help, you to open up yourself, all right? And then the other, let's say, prevention for you, the woman, is self-care. You have to take care of yourself. You have to eat well. You have to drink well, hydrate yourself, especially water, like at least 2 liters in a day. That will help a lot. And then go outside, see the light. Don't always be indoors. Go out, have fresh air, have a walk. Even if you are alone with the baby, take the baby's push chair, go out, go to the park, and just have the sunlight, and that alone helps a lot. And maybe you were very energetic, you were someone who was all over the place, you're exercising and like that, and then when the baby comes, you're just indoors, you're not doing anything. Get your life back. Having a baby doesn't mean that your life has stopped. And so I just want to encourage our women that even when you have to go out with the child, don't be scared that, when I go, the child is going to cry, so I'm not going at all, I'll just stay home. Or even when someone asks you to go out, you say, no, we have to prepare a lot, so I'll just decide not to go because the preparation is too much. Or even if you are breastfeeding and you are going out, you say, I have to breastfeed the child, so I don't want to go. You go out, you can express. You can put it in a box, so you can go out if breastfeeding is a problem for you. So try not to stop your life because the baby is there. Just live your life with the baby as well, all right? And then support system. So I'll say we can have social support or the people around you. When you need help, ask for the help. When sometimes you need someone even just to cook something for you that you can't cook, or to buy something for you that you can't buy, or because of 1 or 2 things you can't go outside. Take the phone and call someone to, please, can you help me do this? Don't try and be superwoman to do everything because you can't. You will break at some point. So ask for help. Even if you want someone to come and look after baby for 1 or 2 hours, and then you have a me time, you just go out. Do window shopping, do your hair, have your nails done, go for a spa or something. That alone gives you a me time, so it will just distract you from every other thing and then concentrate on yourself. Because if the mother is not well enough, how can the mother take care of the child? So please ask for the help. Don't think you can do everything. Ask for the help. And then socially, sometimes we have some meetings, especially if you follow your antenatal. Sometimes you have meetings before and after the birth, where you meet mothers and you talk together about, everybody shares their experience. So even if you go through something, you'll be like, okay, so it's not only me. And then just hearing people's experiences helps you a lot. Or maybe another thing, swimming. Swimming is one great stress relief activity that will help you. And even if you're a mother, you can still, like you have a young child, they have facilities where you can take the baby, or sometimes you can even swim with the baby. So just be knowledgeable about this thing and go out. But then unfortunately, I'll say again, we as Africans, we are not used to go and do activities outside. Like, even if you're telling your husband you want to do something like that, you'll say, oh, maybe it's now baby, just sit somewhere and then take care of the child. Sometimes they don't understand that we need to go out. It will be like it's a stress. Why are you going out? Just stay home. You're on your maternity leave. Just stay home and enjoy. But sometimes being home is not enjoyable. So yeah, that's I would say are the preventions.
Wow. Self-care. Ask for help if you need. Don't think you can do anything on your own by yourself. Don't be a superwoman. Take care of yourself. Engage yourself in social activities. It is not only being in the house that can help you to take care of your children, but I think if you surround yourself with good people who are willing to help you and to understand what you are going through, it will really help. I can also say that most of the time as Africans, we are very superstitious about these things. Someone might think that there is something wrong with you spiritually, that is why you are behaving like that. But at least as Christians, the word of God is also there to comfort us. The word of God is there to give us that comfort that we need. He has sent the Holy Spirit to be our comforter. So if it is like an audio Bible or something, you can put your audio Bible on and be listening to it while you do your day-to-day activities at home. Or maybe put, if you like, a cool music, something to relax your mind, to take your mind off what is actually happening or the disorder that is around you as at that time, and it will also help. So partners, social activities outside, taking care of our own self will do a great deal to help us. Wow. Thank you so much, Lady Judith. You are really giving us insight.
Lady Susie, before you ask me the next question, I forgot to say that in the self-care, prayer, we as Christians, is really, really important.
Okay.
In as much as depression is a mental illness, I strongly believe that any illness or any sickness that presents itself physically has a spiritual background. So we as Christians, we need to balance the two. So yes, you pray. Yes, you have your prayer partners. Yes, you tackle those issues, but then God has also given us the same knowledge to this expertise who can help you treat it. So if you are sick, you pray and then you go for treatment. So I don't want us to maybe think that it is just one part, it's just physical, but then yes, it is spiritual. So get a prayer partner. Your husband is the first prayer partner you should have, and then if you have let's say trusted people, I repeat again, trusted friends, trusted women, you can open up to them. It is the best. But then yes, try and know that it is spiritual and physical support.
Wow, it is spiritual and physical. So be an all-round Christian. Put everything together. a little of this, a little of that, and then God is going to help us. Lady Judith, when a mother is depressed, I believe everybody around is also tempted to be affected by her behavior. So I will want to ask, can our partners be also depressed, or can we pass on our, is it possible for us to pass on our depression to our partners? And then how does it affect our children also? Because it is said that when you're a mother, whatever mood you are in affects your baby. So does it affect our partners and our children also?
Thank you. I'll start with the children. Yes, it will affect them because they won't have their their all-round mother, their total mother is not in good health. So of course, she will not be able to give the maximum love, compassion, and affection to the child. As I said earlier on, a depressed man doesn't have chemistry or have mixed feelings with the baby. So the love that we have holding our children, when breastfeeding, the connection, all of that can be altered. So of course the children will be affected, and especially if you have other children, and this is maybe your second or third child, the children will lose you. Like mommy is not herself, mommy is not caring for us, or maybe mommy is not cooking for us, or mommy is always disturbed, or maybe she's always in the room, we don't even know what's happening, you're not caring for them and all of that. So yes, it will affect the children. And for the partners, it does affect them. And it will be surprising that partners or husbands to go through postpartum depression. They go through postpartum depression. They don't, the symptoms are not like the woman's own, of course, because they didn't give the birth. But then, because of the pressure, because of looking at the wife not being able to, not being able to help sometimes, maybe they are so confused and they go through their own depression as well. And we know the men are used to keeping things from in themselves, so they will not share, and then it will just bubble up, and then you hear at the extreme that the man has committed suicide or something like that. But then some little symptoms I can mention about postpartum depression in men is when they feel excluded by the mom and the child. So the man will be so attentive, or will be all over the baby, and the husband will be left away. Or the husband, knowing that he is the one who is providing for the family, if there's financial issues, he will think a lot. He will always be worried, if I can take care of my family, or if I can take care of my wife and my baby. Or even they are so depressed, or let's say they are so anxious and stressed out that they become workaholic. They're always into work, and they don't even want to be home sometimes, or even they get distracted, and then reckless driving, accidents, or sometimes even having extramarital affairs, because for one reason or the other, the woman is not being able to have sex with the husband. So they feel they are left out, as I said earlier on. So they feel they are not good enough as fathers, or maybe they have lack of concentration. They, even at work, sometimes either they are too workaholic, or sometimes they are not performing well at work. So yes, men to go through the postpartum depression, but not all of them. And then the symptoms are not comparable to the women, I would say. Yeah, but yes, they go through something like that.
So that is why it is not only for the new moms, but it is for everybody, so that we will be able to identify it when we see it happening in ourselves, our men, or maybe somebody you may know who is experiencing or showing those disorders. So Lady Nurse, I will ask, how complicated can it be How complicated can a postpartum depression be? Are there stages? How does it go?
Yeah, thank you. So, as I said earlier on, there are complications, and the baby blues part is not something to be worried about. I will repeat again because it's a normal feeling that all women go through. Okay, so that I'll repeat is from the first few days to the 2 weeks or 3 weeks after you've given birth. But then when the symptoms are, they are more problematic, they are more, yes, they're more problematic, and then you get into the postpartum depression. Once you get to that stage, if it's not treated or if it's not dealt with, then it becomes more problematic, and then we can talk about psychosis. Psychosis, let's say, is the most
the highest stage.
Yeah, the highest stage. Yes, the highest stage. And once you get to the psychosis, you really have to get immediate help. Like, you don't have to walk around or maybe have someone tell you, oh, you just pray about it, or something like that. Psychosis is quite serious.
Severe.
Some examples can be having hallucinations. So you hear or you see things that don't exist. You will hear voices telling you, do this to your child, do that to your child, or you hear, you have thoughts, things that are not normal, but then for you, everything is normal because you see them and you feel them. So for you, it's normal, but then if you have somebody close to you and you are showing these symptoms, you will surely quickly click and say, no, something is wrong somewhere. So, or maybe you are too suspicious. Any little thing, you calculate and you say, okay, this person is doing this because he wants to do this to me, or something like that. Or you even get to a point where you are harming yourself or the baby. So there is a particular syndrome called Munchausen syndrome by proxy. I'll repeat again. I believe the media team will put it in the comment section. So Munchausen syndrome by proxy is when the mother tries to do everything to get attention. So I'll read it out. So it's a mental illness related to postpartum depression against self or the baby. So the mother will make up some injury to the child, or the mother will make up some causes for the child to be sick to get the attention. So, I don't know, example, the mother will just put some things in the baby's throat just for the baby to choke, and then the mother will even call for attention, call the ambulance or something that, oh, my child is not well, or something has happened to the child. And this is really serious. It can get to death. If the baby is really small, it can get to death. Other examples of this Munchausen syndrome by proxy is when the mother wants to create an illness for the baby for no reason, for the mother to get attention. So he will say the baby is not well, the baby has fever, the baby has diarrhea, or the baby is sick. But then even when you go to the hospital and tests are being run, we see the baby is perfectly normal. Or another sign can be frequent hospitalization. So we know this mother, we know this woman, she always comes to hospital with the child saying this, but apparently there's nothing like that. And these people can be so knowledgeable in the terms of sicknesses or things like that, so they know what they're talking about, but then it's not real, it's not there. So this is quite, let's say, I can say maybe the highest, yes, and yeah, the highest stage of depression that it can get to. Yes.
Okay, so if you are just joining us, we are talking about postpartum depression, the disorders that new moms go through after having their babies. So if you are there, it might be not severe, but little. You should be aware that those things that are happening to you are not normal, and then if you need help, you ask for help. We are talking about postpartum depression. Ladiness. So if we want to, how is postpartum depression treated? If you realize that somebody, or I realize I'm depressed after birth, just after birth, and I am diagnosed with postpartum depression, what will be the treatment they will take me through?
All right, thank you so much. So, yes, the baby blues, as I said, it's not an illness, so that will not be diagnosed. But then, when the symptoms are more and more problematic, then that is when you will see your doctor or your GP, and then once your symptoms are being mentioned to them, that's when you will be referred to a psychotherapy. So you go through a psychotherapy, which it will be a psychologist, a mental health provider, or psychiatrist to go through this treatment. So I would say the first means of treatment is the talk therapy. In normal words, that's how they call it, the talk therapy or the mental health counseling. Or another way to call it is the cognitive behavior therapy. Cognitive behavior therapy. So during this therapy, this is just a talk. You go to these counseling sessions, and then the health provider helps you to be more realistic on how to deal with problems. So yes, problems will come. Yes, situations will be difficult, but then they will help you how to solve them. Okay, so it is called cognitive behavior therapy because when you are doing this counseling, they know the right questions to ask. They know how you behave towards some situations, so they will help you how to go through about it. Yes. So this therapy or this talk therapy sometimes can involve the partner as well, because of course you are living with the woman, so it's also even helpful for you to be with the woman during this therapy. So this talk therapy, this is the first means. So once the talk therapy or the cognitive behavior therapy doesn't work, that is when you go into the medication. So that's when you'll be prescribed medication. And the medications they will prescribe you are called antidepressants or mood stabilizers.
Okay.
And as we are talking about postpartum depression, so that means you will be breastfeeding. And we know any medication you are giving you the woman take, it goes into the breast, and then your child will have some of it. So based on the level of your depression, you will be prescribed medication, and then if we know you are breastfeeding, then we will give you, let's say, the medication that's friendly to the baby, so that will have less side effects that will affect the baby. So even though you are breastfeeding, you can still have medication. Some examples of antidepressants can be sertraline, here in the UK, sertraline, metrazapine, and then the antipsychotic, which is the highest one. You can get diazepam, lorazepam, whereas the mood stabilizers can be amitriptyline. Yes, anything that will try to lower your mood or try to balance your mood disorder. And the highest one of treatment is when every other treatment has not worked. We have the ECT or the electroconvulsive therapy. Electroconvulsive therapy, I'll read it out, is a procedure under general anesthetic where electric currents are passed through the brain intentionally for it to trigger a seizure, a brief seizure. So during this procedure, it seems like this electric seizure that has been done is able to balance the hormones in your brain. Okay, so it can change the brain chemistry quickly and reverse the symptoms that mental disorder can give you. So this is the highest treatment. When you go to the hospital, you are put in under general anesthetic, and then they just trigger this convulsive seizure so that the hormones that are imbalanced in your brain are being put together. So
some people complain that the medications they are giving on takes too much time for the therapy to complete. So what do you say, or what encouragements would you give to such people?
Yeah, yes. One thing is these antidepressants. Once you take them, it takes a while for it to work. So it can take from 3 weeks to a month, sometimes, for them to work in your system. And so if you are taking them and you, like, after a week and then you don't see any changes, and then you just say, I'll stop it, I'll don't take the medication because it's not even helping, you're harming yourself anyways, because you need time for the body to be used to the medication. So whatever prescription and whatever dosage they prescribe to you, you just have to follow it, please. Yes.
Okay, so you don't even have to say, okay, if I've taken it for 3 weeks and I'm already seeing changes, let me just stop because it is okay.
Yeah, exactly.
But you really follow till the end as it's being prescribed to you by the doctor. Okay.
Yeah.
Wow. This has been very, very insightful. I believe that what we have discussed today will go a long run to help somebody who is going through this, or maybe if not to you, you might be able to identify somebody who is having these disorders, and then the needed help that you need to give to the person, you might do it. All too soon we are coming to the end of today's program, and we want Lady Nurse to give us her final words.
Yes. Thank you so much for having me again. So I would say that postpartum depression is not your fault. Postpartum depression is not your fault. Don't be ashamed and don't blame yourself because it is not your fault. But then, as it is not your fault, it is real. The symptoms are real. So get help, recognize your symptoms, recognize the signs, get help and get treatment as soon as possible. And you will recover. It is a process that with God on our side and then with good treatment, you will surely recover. And it's also good if you've been through this period in your life. It's also good even for you to share your experience, to share with women around you, because you don't know who you might help. And yes, I'll just say that you are not alone. You're not alone at all. And then this can be treated. Yes. Depression sometimes after birth can go from weeks, months, sometimes even years, or maybe the year after you've given birth. But then if not treated, then it can even become a long or lifetime illness. So it's really, really important for it to be treated. I believe we'll have more professionals coming on the program to give us more insight about this.
Thank you so much. I would like to go through our comments section here. Thank you so much for being with us. I can see Lady Franchi. I can see Lady Elsie with us, and Fiachiwa also is here. I can see Mommy Tando. She's saying to Lady Ness Brava. Lady Ness, she also saying that get back your lives, ladies. Get back your life. Don't put your life on hold because you have had a baby, but put things together and try to manage everything, and with God on our side, everything will be okay. We have our Ben Sona. I have a brother here who is telling us, God bless you. God bless you too also for being with us. We have Lady Elsie telling us that spot the signs, seek help, and start treatment, and also prayer. That says it all. Spot the signs, seek help, start treatment, and also pray, and it will do us so much good. You have also Matana saying that yes, knowledge is powerful. That is why lack of it destroys you. So lack of knowledge will destroy you. Will destroy you. So it is expedient that we get more knowledge. The internet is there for these things, and then we ourselves too are there to help. So if you are going through any of such, woman, know that you are not alone. Know that what you are going through is just a sickness affecting the way you think, but not who you are. So seek help, talk to somebody, surround yourself with things that will help you release some stress. Even if it has to do with putting off your phone and then being quietly somewhere with your baby or with your family, just do that. And then be a bit selfish, at least for some time. Sometimes be a bit selfish. Take care of yourself. Think of yourself a bit, because as my mom always says, women, we don't get sick. Don't get sick, because if you get sick or you are not doing well, the whole family is in shambles. So get yourself together. Be in good health so that you can take care of the family God has entreated in your hands. Thank you so much, Lady Ness, for sharing this information with us. You've been so much of a help to us, and we are privileged and we are grateful that you always accept to come our way when we call for help. Thank you so much. Thank you so much. And so to the family out there, we are saying that thank you for always coming our way. Thank you for allowing us on your screens to share the mind of God with you. And this one means that as Christians, we should be all-round Christians, not only spiritual, not only praying, but we are seeking knowledge. As it was said in the comment, knowledge is power. And so we will leave you here. We want to say that have a great week, and let everything you do reflect the Christ that we are, the Christ-like life that we are. What we proclaim as Christians, what we proclaim to be. Let everything that you do, what you do to yourself, what you do to others, show the Christ-likeness in you. God richly bless you, and bye for now.